Hi, everybody. Welcome to our next interview with Aryn. I hope you guys enjoyed the ones we posted up so far. Hi, Aryn. Welcome.
Hi, how's it going?
Not too bad. Just getting through the day. It's nice outside, so hopefully when we're done this, I can get outside for a little bike ride or something like that.
Yeah, that will be nice. The sun is shining, so that's going to help everybody a little bit, I
Right?
think.
A little mood booster.
Yeah.
So, why don't you introduce yourself and give yourself a little bit of background and what topics you're going to cover today for everybody.
Yeah, so I'm a naturopathic doctor. I'm in Victoria. Um, I will be talking a little bit about how we approach mental health. So we typically, as naturopathic doctors, start from a pyramid approach. So starting with the foundations of health, such as nutrition, how are you sleeping, what can you implement throughout your lifestyle just to help with your mood and your overall health. And then we kind of work up the pyramid. So the next step might be further interventions such as counseling, seeing other practitioners, and then even further going up into herbal treatments and vitamins and minerals, and then pharmaceutical interventions if it's needed as well. So
Nice. I think it's going to be a very interesting topic you cover. I've been looking forward to it. I think a lot of people are curious as well. So, give a quick question: how did you get into all of that?
into naturopathic medicine.
Yeah, how did you find flow into that?
Um, well, when I was in university, I was always looking in to be somewhere in the medical field. So I wasn't really sure where I was going to go, if it was going to be more chiropractic, acupuncture, or even like considered being pediatrician or OT for a while. I didn't know about naturopathic medicine because I grew up in such a smaller city. My brother, he did research for Parkinson's, and his professor actually introduced the career to him. So through my brother, we actually went to naturopathic medical school together because we felt like it was a career that really aligned with our values. We grew up in a pretty healthy household, so being able to work with people and be in the gym every day really increased our fascination for how the human body works, how we can optimize healing from injuries, proper nutrition, and all of that. So I think our lifestyle just really facilitated our career choice.
So you and your brother are both naturopathic doctors?
Yeah, he's
Oh
in
my
Edmonton.
God. You guys, your parents must be happy. So how are you doing so far with everything?
With COVID and
Yeah,
everything
just
that's
like,
going.
like with the self-isolation or social distancing and all that kind of stuff.
I think as everybody, there's going to be ups and downs. So some days are really nice. They're relaxing. It's a good slow pace. And I really appreciate, time with my partner and that sort of thing. I think it also comes with a lot of challenges. So our work went through a big transition of switching from in appointments, seeing people face to face, doing a lot of hands-on practices, to doing everything virtually. So video appointments, phone appointments. I think that this was a big transition for our clinic and ourselves, but we've had quite a good success with it. So that is actually quite rewarding.
Um, that's actually a good lead on because that's actually kind of what I want. One of the questions I wanted to ask you was, since we're on this topic right now, it's like, since you can't see people face to face, which, normal practitioners, whether it's a naturopath, RMT, physio, chiro, all that, how has that affected people's ability to get better? Is there any regressions? Like, how, I know you guys are doing video stuff, but how have you found that so far with your clients?
I think it's varied a lot from individual to individual. So I've just through contact, some people have been doing really well, maybe because the slowed time has helped with mood and more family time and maybe decompression. And so a lot of concerns kind of went away with that. But I've also seen the opposite spectrum where, people were doing really good with their health, and we were progressing weekly and getting a lot of interventions, getting on a good task. And then being interrupted because we can't do things like IV therapy or
Mhm.
acupuncture or prolotherapy. Like all of those things are taken away. And so even those people who just got out of surgery and not being able to access our physiotherapists, it's been quite a challenge for them. So just the hands-on was quite hard, but it's been, I think our clinic was quite astounded by how much we could facilitate through video. So even if it's teaching a person how to do certain exercises at home or use their partner to help mobilize. So I think there's a lot of power between educating the person on how they can heal themselves. And it really isn't all up to us. Like your healing is in your own hands and you have the power to do that. So I think that this gave us the opportunity to kind of show that.
Well, that's a great message, and everyone's adapting to obviously the new way of doing things until we kind of get back to a new normal, right? So same
Yeah.
thing with the gym, right? We're trying to figure all that stuff out. So um, people may not know, but I've known Aryn a long time through the CrossFit back in the day when I used to do CrossFit. I just want to ask you, with the gyms and stuff being closed, how is that, you think, affecting people's mood? Because they can't go to the gym or hang out with their friends. Because, like I said, a gym like ours and like a lot of other gyms are like a community place, and as much as people get their physical like endorphins and fitness in, it's a big place for their mental well-being as well.
Yeah, that's a great point, Richard. So I know with my practice, like starting from the general basis, like one of the biggest things that we do recommend is exercise to support mood. It increases endorphins and it increases, yeah, just it has so many positive benefits to it. And so to take that away from somebody in terms of, getting that break from their day to go see the community or getting those endorphins from that little hit exercise, it takes a place where people can cope and where people can take a break from the realities of daily life away. And so I have noticed like a profound impact, even with myself. Like
Mhm.
it can be hard to get the motivation to do a workout, whereas before all I had to do was show up and just rely on the community around me to get me through that workout. So I think that it has a profound effect, and I'm really looking forward to the gyms opening again and getting back to that
Yeah,
community.
I think one of the things that I've kind of realized too, it's like um, people kind of, I wouldn't say take it for granted, but they kind of understand now. It's like, wow, like it pushes you. Like I said, sometimes you lack a little motivation. You're like, okay, I got to show up for class because I already registered. And then your workout buddy is there, and you're like, hey, let's do this, right? And just that community that's around it, and it's a good support system that that's always been there, that it gets taken away and you finally realize, wow, that's very important to me. Not that people didn't know it was very important to them. It's just that I think it really heightens that now. And I feel like, yeah, once we kind of get back, it could be, it's going to be great for a lot of people.
Yeah, true. And I've already had like a few people reach out to me saying, weight goals have gone down. Like people have had harder times like reaching their goals or are maintaining their health in ways. So I think it facilitates health in so many ways just to have that support that you guys offer. So
Yeah, well, thanks. Well, let's dig into your stuff. Like, so I'm curious, like, so how do you treat, mental well-being or just in general? Because I'm curious about that.
yeah, so I think, well, the beautiful part of our practice is that it's very individual. So no single person is going to have the same approach. It really depends on what's going on with you. So
Hmm.
it's very, I guess the first question to investigate is like, what would be the cause of the changes in mood? Why are you feeling anxious? Why are you feeling depressed? Is it because of maybe a childhood experience? Maybe it's a trauma, like a physical trauma, such as a concussion. Um, Maybe it's lack of nutrients in your diet. There's so many different causes. So I think the first thing that we would do is just look at the cause and start addressing from the root and then working the way up. Yeah, that's how we would start. And so that being said, I think it's important to look, like I already said, at all the foundations of health. So there's things that even if it's not the cause, it helps you with the coping of it. So One acronym that I use for anxiety, and I got this from one of my colleagues, Dr. Drew Jameson. He does CrossFit as well.
Yes, I know Drew. Yeah.
And he, and so it's called HALT anxiety. And so H stands for hunger. And so when you're feeling hungry, you get hangry, right? Like you know how your mood shifts. And so if you're feeling anxious, it's important just to reflect and be like, hey, did I eat good today? Like, am I lacking that? How can I stabilize my mood? Is it something I need to eat? Do I need to eat better? Grabbing for a nutritious snack such as like avocado and healthy fats that are so good for your brain. A is anger. So releasing repressed anger, dealing with the emotions that you're feeling. Is there a conversation that you're waiting to have with a friend that maybe you've been holding on to? Where is this emotion coming from? What is it? Can you label it? How can you release it in some form? L is loneliness. So this goes back to the community aspect, so that gyms bring, but really, I think a lot of people, when they're down, they tend to isolate. And I think that it really is important to reflect and look on who can I reach out to? Is there a good friend, a family member, a gym? And maybe it's even just walking out in the community, going to the grocery store and seeing other people do things within their daily lives. That helps people a lot. And then T is tired. So sleep is a huge one. And if we can get our sleep on point, that has a profound effect on our mood. I know that if I get under 7 hours, like, you don't want to be around me. So sleep has a profound effect. Yeah. And so we'll facilitate with like our clients of how we can master these foundations. If they're having issues sleeping, how can we tune this in to be better? We might need supplements as an assistance to start. So things like L-theanine and GABA, for example, can help calm you down if you have that racing mind. And just working through sleep hygiene until that's mastered. What's your routine look like? Are you pausing throughout the day? And just working with the foundations first.
Well, I think that's a good point you're bringing up with sleep. I know you want to mention something about sleep quality. We can maybe go a little bit about that, because people sleep every day, obviously, but some people sleep very well. Some people don't, like it's very all over the place. So maybe that's something you can shed some light on.
Yeah. So when we look at sleep, there's a lot of ways that it can be affected. So if you're like having difficulty falling asleep or staying asleep, and typically you should wake up rested. And if you don't believe that this is like normal, then like that's the sign that your sleep quality isn't great. I remember the first time I was in naturopathic school and they're like, if you're not waking up rested, that's abnormal. And I was like blown away. Because
no, that's true. It takes a lot of, like, I wouldn't say self-reflecting, but it takes a lot to understand your body even to get to that state though. Because I know, like, when I'm feeling well, it took me a while to figure out where when I sleep good, I wake up, I feel like, okay, like I'm ready to go, right? Whereas like sometimes I'll wake up, I'm like, oh, like, I'm just not feeling the greatest. And then I've learned through time with obviously training a lot and also being sick, like knowing your body. And I think that's something that's a big thing to take away, is knowing your body. But that's different for everyone. But that's something that I personally found that it took me a long time to just understand, like when I'm like, oh yeah, you know what? I think I might be getting sick, because I know how my body feels, right? But that takes a lot of self-awareness, right?
Yeah, and it's just becoming more in tune with your body and understanding. And I think even things like bowel movements, for example, like a lot of people don't pay attention to that, and it's one of the most important like representations of health, because elimination, it's detoxifying us, it's showing us how well we're digesting our food and using those nutrients. And so a part of my profession is just to help people become more in tune with their body, and that might be even through like journaling and just discussion.
Going back a sec about the sleep quantity. Now everyone's different. Now, is there like a quantity that's in, like some people might take 6 hours, some people might need 10. Do you find something, is there like something you see that's normal, like not normal, but you know what I mean? Like that is recommended?
I truly believe that at least 7 hours is needed.
Okay.
Some people tend to say they need less, but I don't know if I mean, I would wonder if they actually got 7 or 8, how much better they would actually function. But yeah, athletes tend to need more.
For me, like 7 to 8 is ideal. Like if I don't like to
Yeah.
sleep too much because I get too tired actually. But I find like
Yeah.
in that window, if I have good sleep and I wake up, I usually wake up like within that time frame if I'm like just normal.
Yeah, I agree. And I think like 10 is getting a little bit too much, but again, it depends, like, are you sick and
Yeah.
how much are you training? I actually listened to a podcast the other day saying that, or no, it was a book that I read. Um, it's on optimizing nutrition and sports. And they were saying that if you want to have like the optimal benefits from training and gaining mass and all of that sort of thing, that you should be napping after every workout that you do, and that you should be getting like at least 7 to 9 hours of sleep a night. So that's a lot of sleep.
That is. I mean, hey, you know what? I'm sure I feel like that after training a lot of times, but hey, we have jobs. Like, if that was the idea,
Yeah.
if we were full-time athletes, hey, nap every day.
Yeah.
You know what I mean? That's the
Exactly.
best thing to do, right? You'll feel great.
Yeah.
One thing that's really interesting that you brought up and I kind of wanted to talk about was gut health. I mean, that's really interesting. Could you maybe dive into that and let everyone know kind of what you do and more about that?
Yeah, so I kind of said this in my intro, but 90% of our serotonin, which is our happy hormone, is in our gut. And so if our gut is inflamed or not functioning optimally, then this really starts to affect our mood. And so our gut can be affected by many things. It can be affected directly by what we're eating. So lots of inflammatory foods, which is mainly processed foods, like anything with a bag or a box with like more than 5 ingredients or ingredients that you don't know how to pronounce. I like to call this the chemist test, because if you need to be a chemist to understand what's in your food,
Nice.
you probably shouldn't be eating it.
Yeah.
Um, but then also other inflammatory foods like sugar, pretty much white foods like white flours, yeah, so all of that can like impair your digestion. I know that gluten is a big fad, so if there's things that you're eating that can't be broken down properly, they tend to get stuck in your like lining and cause an inflammatory reaction to start. And so it also interrupts the immune system and that sort of thing as well, and your body just can't function as optimally because it's inflamed and it can't absorb those nutrients that you need properly to function. And so it's our goal to kind of repair the lining of your gut, and also make sure that you're getting the nutrients that you're lacking just because you weren't getting those through your food or absorbing them.
So what I'm understanding is like eating like foods that causes your gut to inflame, you can't absorb all the nutrients that you need, causing you maybe your mood could affect your mood, your performance, obviously, and everything that kind of goes along with that. Is that on the right page there?
Yeah, that's a perfect summary.
Okay, don't say that. I'm not perfect. Okay. Okay, here's another interesting thing I read that we talked about is efficient breathing. Why don't you expand on that?
Yeah, so breathing, even if you think of like, I notice myself when I'm on the screen a lot that I'm not actually breathing efficiently. And so later on, I almost have to take like gulps for breath. And so when you're breathing faster, everything else in your system starts to go faster. So your heart rate. So if you were to take like a few deep breaths, like even when you're laying in bed, counting like to 4 on the inhale and 4 on the exhale, you will physically notice that your pulse gets slower.
I just
And
took a deep breath
so,
right now.
and what do you feel?
Better.
Relief,
Yeah,
yeah.
yeah.
So there's a lot of benefit just from using your breath to like slow you down and to shift emotions, to know that those emotions aren't permanent. And then even to go further in this, there's healing, or there's like breathwork seminars
Yeah,
that they use
definitely.
this as like a form of healing, of tuning in with emotions and making realizations that you weren't even aware of. And this is something that's been introduced to me within the past year or two, and I've seen profound effects with breathwork circles, and I've even heard people say that they've accomplished like years healing that would have otherwise taken years
Really
worth just
interesting.
through like talking or journaling. So it just amplifies how crazy and how effective just breath work is, and
Like
how much. Yeah,
and
go ahead.
mindfulness and just being in
Yeah,
tune with your body, right? And like letting it relax kind of thing, right? Because we're always in a high with nowadays there's so much stuff inundating us, right?
yeah, definitely.
Interesting. Okay. Okay, here's one that people tell us all the time. Have 8 glasses of water a day. Now, hydration is very important. So why don't you, how important is it?
Very important. So I think it's crazy the amount of symptoms that can come from dehydration. It can be hunger, it can be fatigue, it can be dryness, it can be decreased functioning. All these like general concerns you get can be sometimes just fixed with drinking more water. So everybody is going to need slightly different
Yeah.
amounts of water. I generally tend to say 1 liter per 50 pounds of body weight. But of course, that's also including water from your food and smoothies and other things. Um, but yeah, water is very important. And I would just say, essentially, you want to get your pee to like a slightly like more clear. If it's like yellow, it's usually a sign that you're dehydrated. But you also want to be drinking water throughout the day, because we can only physically absorb
Yeah.
so much at one time.
I've seen those
Um,
bus signs. Your pee should not look like a lemon. We've all
yes,
seen those bus
exactly.
signs. PSA, PSA. Now I'm drinking water right
Yeah,
now. See?
I love it.
I know, right? You already got you,
Representation of
you
health.
you already got you already got you already got me going here.
Yeah, so
Oh,
find your
yeah,
favorite water bottle and carry it around. Just have that in
yeah,
sight with you all the time.
perfect.
But yeah, sorry,
And that
continue.
saves the environment, which we all want
Yes,
to do as
yeah.
well. Okay, well, you know what? That's really awesome that we're talking about things that kind of like we can just do ourselves, like without even like like needing to see someone to do something. Now, I would like to maybe dig into stuff that the treatments that you do, and like that can help people as well, because I think a lot of people are curious about those things as well. Like, why don't you go over some treatments that you do and just kind of label what they are and how they help as a naturopath?
Yeah, so I think, again, just like going a little bit more on lifestyle, I think that journaling is actually a really big one for me.
Okay.
And I think everybody journals a little bit different, but there's been research showing just behind those who write a goals list or gratitude every day, it retrains your mindset. And so it has the power to shift things to be more positive, to be more productive. And so by just taking like 5 minutes out of your day just to write down a few goals or things that you want to do, it can really change your intentions for the day, because that's what you've planned. Um,
Yeah. Earlier, one of the interviewers, Daniel, talked about, it's great that people journal and write their gratitudes and stuff. One thing that he mentioned was to, when we do this, understand the reasons why we're doing it. Like, actually understand the reasons why we're doing it, not just like, oh, I have to write 3 things I'm grateful for, and like just kind of, what I mean? Like kind of take a
yeah,
step back and really reevaluate like your values, or like what what you are, and look into yourself. I mean, it's great that people are doing that, but there was a great point he brought up was like, hey, everyone's doing all these things, which is great because it's starting the word and starting the ball rolling. Because like one thing to be aware of is to make sure to really, like, when you're doing this, have some intention. You know what I mean?
yeah. And I think challenging it too, like what made me happy today? Oh, like the food I ate. Like we're not necessarily, we're looking for, okay, this bad situation happened, maybe pull something good out of that
Yeah.
you got out of that bad situation.
Yeah.
But yeah, it is a lot about intention. So that's a great
Yeah.
point. Thank
Exactly. Yeah. Well, he brought that, so I was just trying to connect the dots here.
you. Yeah. But yeah, going into a bit more even of supplements and herbs is something that
Yeah.
I would love to talk about.
Go. Yeah. Please.
Um, yeah, so I think vitamin D would be a good starting point. Um, Vitamin D is a very interesting one because there's been deficiencies in vitamin D associated with higher levels of depression. So it's interesting because we live in West Coast where we're in dark light throughout the whole winter.
Gloomy.
And so we'll see higher rates of seasonal affective disorder, crazy amounts of it. And so what happens is the sun, it actually stimulates a reaction in your skin to produce vitamin D. And so when we're not exposed to it through the sun, then we're prone to higher rates of vitamin D. Elderly populations as well tend to be lower. So there's and even if you're working inside all the time, you're going to be lower. So vitamin D is something that can be measured in the blood. And then if you really want to, like if you are having mood disorders, it would be something to consider and just optimizing your vitamin D levels, because there is a sweet spot. Too much can have negative effects, but not enough is also going to have negative effects.
Nice. Well, I'm going to get outside today, so I'm going to do that.
Yeah, I think we're lucky this week that we'll be getting natural vitamin D just by getting some of the sunlight. And that just goes into mood itself of like getting outside and you know, getting that fresh air. That's naturally healing to your mood. And I guarantee if you're in a little slump and you go for a walk around the block, you'll be feeling a bit better too.
What about like supplements and herbs? I'm really interested in that. It's kind of interesting.
Yeah, so the big two other supplements that we usually look at to support mood. So one is probiotics, and this goes back to the gut function. So if we have an imbalance of good and bad gut bacteria in our gut, it really interferes with how we're digesting and what our mood's like. So just reestablishing that healthy gut flora is a good one. And then fish oils is also really good. So typically, if we're eating fish in our diet like 1 to 3 times a week, we don't need to be supplementing with fish oil. But fish oil does have an anti-inflammatory effect, and it is an omega-3 fat. So majority of our brain is actually made of fat, and so it can go directly to our brain and just help decrease inflammation and help things function a bit smoother, more optimally. So fish oils is a big one that I look into implementing right away, and it's also pretty safe to do that for most people.
Now, how do we get more probiotics in our gut? How can we do that?
So it's like the reason why you're taking probiotics depends a lot on what strain you're going to be taking and the dose. So some people will require a supplement. So I would say supplementing with probiotics if you've had like a lot of antibiotic use or that sort of thing, but just naturally through our diet, through fermented foods. So adding a little bit of sauerkraut to your meals, or having kefir, pretty much anything. Yeah, kimchi is wonderful. Yogurt is controversial. Like if you're eating yogurt that's unsweetened, has low preservatives, then it's awesome. But it tends to be the ones that have a lot of sugar and added things that are not so great.
Yeah, I mean, you're adding all that stuff in there. Well, that's cool. That's good to know. What about things for boosting mood? Like anything else?
Yeah, so specific to depression, 5-HTP, it's a supplement that's used to help increase serotonin levels. So again, help increase mood, but it can also be taken before bed to help you sleep. And so 5-HTP is a really good supplement for those who maybe aren't sleeping well and who also tend to have a lower mood, or tend to be a little bit more anxious even. The other one specifically for depression is the herb St. John's wort. And this is lots of research behind it supporting mild to moderate depression. It also increases the serotonin levels, and it's an adaptogen herb, meaning it helps you adapt to both physical and mental stress. So it really does kick the edge off, and it can be very helpful. The two things with 5-HTP and St. John's wort is because they increase serotonin levels, you don't want to be taking them with antidepressant medications. And St. John's wort also has some drug interactions, so you would want to be more cautious with if you're on birth control or any other medications, it might affect their efficacy.
Okay. Anything else you want to add to that, supplements or stuff that that how you treat your patients and just we find interesting and curious? Because I think a lot of people are just interested in what, like I said, can help, not necessarily recommended to do so, but just like things that you do, right?
Yeah. So I guess other big parts you would want to consider is if your body is inflamed, you would want to consider anti-inflammatories, so like turmeric or boswellia. Higher doses, of course, would require supplementation, and otherwise, even just cooking with like turmeric in your diet, you do need to add a bit of oils for it to be effective. And so one thing that my brother and I love to do is we cook our breakfast was you sometimes like sweet potatoes or yams, and we would just cook this in a coconut oil and add a lot of turmeric to it, and then we would have that with our eggs. And so
Nice.
the turmeric is anti-inflammatory, and then the eggs, they provide choline, which is also supportive to your brain. And then adding in a little bit of like green vegetable, because green vegetables are so good for you and very antioxidant. Yeah, so anti-inflammatories would be something to consider. And then I would also just love to touch on, like we've talked a little bit about depression, but things that we can do for anxiety as well.
Yeah, that's great because like I said, I think that's kind of coming up with a lot of things that's been happening, situations people are in, like possibly losing a job or just being stressed out and it's causing anxiety with, making ends meet and all those kind of things, right?
Yeah, definitely. So I love teas for anxiety, and I love teas because not only are there teas that are calming, but the gesture of getting a tea is also very calming in itself, and like holding the warm tea and just doing that gesture for yourself. A few ones that I love to use to help promote sleep or reduce anxiety would be chamomile or lavender or holy basil, passion flower.
Ooh, passion flower. Let's
Every
try that one.
Yeah, passion flower.
Yeah.
Yeah, it's everybody has a little bit of a different taste
Yeah, yeah,
preference.
yeah.
My personal favorite's holy basil. It's like
Okay.
earthy tasting,
All right.
very grounding. I love it. And then there's also nutrients that help decrease anxiety. So magnesium glycinate, it's a really good one for athletes because glycine is actually an anxiolytic, but magnesium, it's a nervous system relaxant. So it helps your muscles relax. If you have a lot of muscle cramps and spasms, it can
Okay.
help take those away. So I like to take that before I go to bed. And then other ones would be GABA and L-theanine. Those are very common if you're feeling like that racing mind, racing heart, very jittery. You can either take it when you're feeling anxious or before bed. But yeah, of course, like work with a healthcare practitioner and they'll
Of
help you
course, yeah.
sort through the best ones for you in the safest way.
Well, I think you provided a lot of insight actually onto what you do as a naturopath as well, but like how that can affect people's mental health. Because I think it's all connected. I think that's one thing that you guys do that's really great. It's everything's kind of connected, right? Everything. That's what's you guys are different by treating, not just like the what's going on. You're trying to see beyond that and the root cause of everything. Uh,
Yeah, thanks for recognizing that.
oh, of course. Do you have anything you would like to leave off with, like to anyone that's watching right now, like a couple pieces of advice or anything you want to add?
I would say just to be, I guess the biggest thing I would say is like your feelings are valid. So we're all going to go through ups and downs. We're all going to experience different things throughout this time. So just making sure that you realize that and that you reflect on it. And if you do need support, then never feel ashamed or hesitant to reach out.
Yeah, that's a big part of what we talked about earlier with another interview was just a stigma, like, like it's okay that not everyone's perfect. Like I said, we talked about technology and how it kind of, it affects people because everyone sees the best thing that's happening, but no one sees behind the scenes when it's tough, right? and they only see that, and you think everyone is like that, but that's not the case, as we all know. Actually, we actually know that, but for some reason when we see it, it could affect us, right? Like, oh, they're doing so well, or look at them, right? And it's like, oh, what about me, right?
Yeah, and there was a quote I saw the other day, and it was like, the friend that always seems to be okay, like reach out to them and ask if they're okay, because
That's a
some
good one.
people don't show it. So you never really know what someone's going through.
Yeah, and that's a big part of what we're trying to do here, is just bring awareness so people can talk to someone, or at least it's okay to share with someone you feel safe with, right? And at least even doing that is a big thing. Whether you seek extra help or not, that's a way better step already, just doing that, right?
Yeah, it takes a lot of courage to do
It
that, for
does.
sure.
Okay, well, we're going to end off with a little fun thing that I've been doing at all my interviews right now. It's just a quick little rapid fire question. So you just answer, I'm just going to ask you a few questions, just answer them, and that's it. Okay?
Okay.
Okay. Favorite ice cream flavor?
Cookie dough.
Say a word in Spanish.
Hola.
Do you believe in fate?
Yes.
Favorite number?
5.
Have you ever worn socks with sandals?
Yes, all the time.
Name a primate besides monkeys.
Gorilla, does that count?
Okay. Is double dipping at a party ever acceptable?
No.
Not anymore.
Yeah, definitely not now.
Not anymore until we get the vaccine, I guess. Okay, well, I want to thank you for coming on this project with us. And you provided a lot of insight and a lot of valuable information. I think a lot of people are going to find informative. We may have to do this again, because I think you have a lot of interesting things to talk about, whether it's maybe athlete stuff or other topics. So maybe if you're up for that sometime, we'll do that.
Yeah, for sure. Thank you so much for organizing this. I think it's going to go a long way, and everybody really appreciates all the work that you've put in to get this organized. And I think a lot of people are going to benefit. So it's great as a gym owner that you're looking beyond just exercise and exploring the mental health aspect. I think that that's very unique and very great thing that you did.
Well, thank you very much. It's, for me, like when I, getting into this, like the gym thing, it's not, obviously I love this, what I do as opening a gym for physical fitness. But like I said, I care about people, right? Or like we care about people at Dynasty. That's what we're trying to do. And whether it's physical or mental, it's actually the same thing in my mind, because it's all hand in hand.
It's all connected.
Yeah.
Yeah.
Okay. Well, thank you very much. Have a good day and get outside and enjoy the sun.
Yeah. Thank you, Richard.
We'll talk to you soon. Okay.
Sounds good. Have a good day.
Bye.